pulmonary hypertension is when there's high blood pressure in the lungs. People may be used to high blood pressure in the arm, which is the blood going around the rest of the body, but the lungs have their own separate blood supply. Measuring high pressure in the lungs is not so straightforward. We normally have to pass a catheter from the arm to go into the lungs in order to measure it properly, but we can get a pretty good idea from an echocardiogram. High blood pressure in the lungs is always important. It causes significant breathlessness over and above what you'd expect for whatever is causing the high blood pressure in the lungs, and if not treated, it leads to a bad outcome. The most common reason for high blood pressure in the lungs is heart disease. And again, intensification of the treatment of heart disease becomes a very important part of its management. The second most common cause is lung disease, such as emphysema or scarring of lungs. And again, that needs to be investigated thoroughly and managed. The rarer groups of high blood pressure in the lungs are probably the ones where we've got the best and most important treatment, and therefore are very important to identify. So thickening of the lung vessels causes severe breathlessness. It is very progressive and causes death if not treated, but we do have treatments for it. And finally, clots in the lungs that have failed to dissolve. This doesn't happen very commonly, but it is very important because we've got good operations and good angioplasty treatments to remove those clots and get you back to normal.